Hello, my name is Dr. Jeff Hester, and I'd like to talk to you today about the decisions that school boards and superintendencies and other decision makers are going to be facing as far as what to do with schools this fall. To open or not to open? That is the question. A little bit about myself. I am an astrophysicist by training. Had a fairly high profile career working with space telescope, so on and so forth. For the last few years, what I've been doing is working instead as a coach, thinking partner, consultant, working with professionals, executives, organizations, facing the challenges of succeeding in rapidly changing times. Um, Wearing that hat, I have been paying very close attention to COVID from the get go. I'm also, though, a very long term advocate for public education. Back in the day, I've chaired bond committees, capital override committees. I helped write a $5 million grant for science teacher training for a local district, so on and so forth. My wife's an elementary school principal. We've got two daughters who are public school teachers, grown daughters. We have a 10-year-old daughter and four grandkids who are in the school system. Anyway, so it was kind of an obvious thing for me to take my analyst's hat thinking about COVID and apply that to what I know and my experiences with public education. And when I do that, I have concerns, and I want to talk about those. First of all, just right off the bat, if you're a board member or something like that, this is not what you signed up for. You didn't say, hey, I want to go try to shepherd a school through the worst public health disaster in the last century. Um, Power to you. Thanks for your efforts. I've known a lot of board members over the years. I've known a lot of superintendents over the years. And there are very few of them that have not been really good people who were there trying to do the best for everybody. And so you understand that your primary responsibility is to the health, the safety, the well being of your students, your educational team, and your community. Now, with all of that said, as I said, we've got a 10-year-old at home. And so I know full well everybody wants their students to be back in the classrooms. But it's not just a funny, the kids are driving me nuts thing, because it really does matter. Education is important. What kids get out of school is important. And that is especially true of kids who face various challenges. That's where kids should be. We don't need blue ribbon panels to tell us how important schools are, or that just simple online education is not enough. But what do you do with that? Well, right now, to tackle this, there are only two rules that you have to keep in mind. The first of those rules is that COVID-19 is making the rules, and COVID-19 doesn't care. COVID-19 doesn't care about politics. COVID-19 doesn't care about education. It doesn't care about economics. It doesn't care about what's best for our kids. It doesn't care about anything. COVID-19 just doesn't care. And so I can say I want to be able to flap my wings and fly, but that doesn't mean that I can do it. In like fashion, I can say that I understand how important it is to open schools, but I have to recognize that that doesn't mean that I can do that either. As far as COVID-19 is concerned, statements like, I really want my kids to be in school this fall, along with $5 will buy you a cup of coffee. What we want just doesn't matter. I said there were two rules. The first rule is that COVID-19 is making the rules and COVID-19 doesn't care. The second rule is, see rule number one. That's all there is to it. Now, before I dive in too far, I'll say the obvious. COVID-19 is not just the flu. Talking today, we're looking at something like 3.8 million confirmed cases in the United States. We're talking about something like 141,000 deaths. Those that survive the disease, many have health consequences that are going to be with them for the rest of their lives. COVID-19 is a real thing. Any group, by the way, that's making the kinds of decisions that you are faced with needs to spend some time and talk to ICU doctors and nurses who are caring for COVID-19 patients. Go to the source. Find out what it's like. Find out what those realities are. If you have those conversations, they will quickly disavow you of the notion that COVID-19 is just the flu. Now, another thing that you have to keep in mind about COVID-19 is that it hasn't even been around for a year. We've only known this thing for a few months, and it keeps changing on us. It started out, it's a pneumonia. Well, it's actually not a pneumonia. It turns out it's attacking the heart and such as that. But really, no, actually, it's more of a vascular disease. And it's attacking the kidneys, and it's attacking the brain, and and so on and so forth. The fact is that our ignorance about COVID-19, especially its long-term effects, far outweighs what we know. Lungs, acute respiratory distress syndrome, lifelong lung damage, sometimes even with mild cases. COVID is a vascular disease, all sorts of bizarre clotting effects. It does heart damage, leading to future risk of heart attack. It causes renal failure, putting people who were perfectly happy on dialysis. Neurological disorders that go along with it, including fairly severe cognitive defects, inflammatory disorders, things like multisystem inflammatory syndrome in children as examples. And I could go on and on and on. This thing just keeps throwing surprises at us. And the answer most of the time is we really don't know. I mean, it was only a matter of a couple of weeks ago that the World Health Organization finally said, okay, you're right. COVID is airborne. Okay, which is kind of a game changer, especially if you're trying to talk about how to do things safely. As an example, one sort of intriguing thing, I could pick a lot of things, I'll pick on this one, is that COVID affects the way that we clot. This is something that's come out of a lot of autopsies of patients who died, other kinds of data as well. Turns out that the kinds of cells that are responsible for producing the clotting material, producing platelets, that are normally found in bone marrow and perhaps a bit in the lungs, in COVID victims are being found all over the place. And as a result, clotting is being found all over the place. Everywhere from major artery clotting leading to strokes to microclots in organs throughout the body. So talk about the brain, for example. Reading from a couple of articles here, coronavirus autopsies. Oxygen deprivation of the brain and formation of blood clots may start very early on in the disease process. That can have major implications for how people with COVID-19 are treated at home, even if they never need to be hospitalized. The group noted in a paper that the widespread presence of tiny clots in the brain was striking. There were large swaths of damage in the brain due to oxygen deprivation, whether the deceased were long-time intensive care patients or people who died suddenly. The pattern was eerily similar. The findings suggest the damage had been happening over a longer period of time, which makes him wonder about the virus's effect on people who are less ill. The big lingering question is what happens to people who survive COVID? Is there a lingering effect on the brain? And I kind of picked on that one because that is as true for children who are asymptomatic as it is for adults. I mean, anyone who tells you that they can state with confidence that COVID does not typically have long-term significant impact on the health of children is misrepresenting the facts. Fact is that we don't know. Now, how to think about this, how to approach it. I'm going to use moldy bread as a metaphor for COVID here for a minute. There you've got some really nice moldy bread and a kid comes in and says, "Hey Mom, this bread's all green and moldy." And clearly Mom responds by saying, "I can't be sure exactly how sick it's going to make you, so go ahead, eat it." Went no conversation ever. COVID is one very moldy piece of bread, and the presumption has to be right now, with everything that we know, that opening schools is dangerous. In talking about opening schools, the burden of proof is not on people who want to say it's dangerous, you shouldn't do it. The burden of proof is squarely on those who argue that schools can in fact be opened safely. One argument that you hear along those lines is people will say, well, they're doing it in Europe. They're opening schools. They're doing this in Europe. They're doing that in Europe. Let's look at that a little bit. Here we go. There's Spain, which had the biggest outbreak in Europe. And what happened in Spain is that the numbers went up, exponential growth, but they shut things down tight, and they kept them shut down for months as COVID slowly died out. That's just an exponential decline, if you're interested, until they got down to where they are today. So there's Spain. There's Italy, pretty much the same thing. There's Germany, pretty much the same thing. There's the EU as a whole. One country that really just nailed it was New Zealand. They took a lot of grief early on for, oh, you're locking things down too tightly. Reality is that New Zealand has pretty well beaten the thing. And that's what it took. So there you go. There's, when you talk about Europe, that's kind of what you're talking about. Great Britain, not as, United Kingdom, not as great, but still not too bad. And then there's the United States, which is a completely different trajectory. We never did really lock down as a country. We never did get this under control. And then we lost our patience and opened up again, and we're right back into exponential growth. The United States is not Europe. Experience from we did this in Europe, why can't we do it in the United States, is just kind of meaningless. Another way to see that, once upon a time, an American passport was the right kind of passport to have. It would get you in more places than almost anything. This map right here, though, the red countries are the places that will not admit you now if you have a U.S. passport. Because if you're from the United States, you're diseased. They're doing it in Europe doesn't mean anything. Now, I won't go into detail here, but you can take publicly available data and make some estimates of things like what fraction of people have had COVID, what fraction are susceptible, and what fraction are currently infectious. For the United States as a whole right now, these are uncertain numbers, but they're reasonable to look at. Maybe something around 1% of people in the United States right now are actively infectious. In Arizona, that number is probably on the high side of 2%. And in Germany, that number is like 0.013%. Okay, let's put that into context. They say, hey, they're reopening in Europe, they're reopening in Germany. Why can't we do that? Well, because the United States as a whole is about 60 times worse off than Germany is right now in terms of the number of infectious people wandering around. Arizona is probably about 160 times worse than Germany right now in that regard. I should also say that the United States is only about 5% of the way to herd immunity, probably, which means that this thing is not behind us. We're still in the bottom of the first inning with this thing. We've got a long way to go. So, when somebody talks about how, hey, they're doing it in Europe, why can't we do it here? Just sort of have this visual. There's opening schools in Europe. Take a single aspirin, no problem. There's opening schools in the United States where the number of aspirin you would now have to swallow would probably be something like 5 times the lethal dose. There's just no comparison. They're doing it in Europe is a nonsensical comment to make. Now, another thing that you hear people say is, but I thought children couldn't spread COVID. There have been a lot of claims like that around. From early on, there were a lot of claims like that around. But again, the science is rapidly changing, and that's not the direction the science is going. For example, just the other day, there was a big study, 65,000 people in the study coming out of South Korea. And what they found is that children 10 and up are able to spread COVID just as effectively as adults are. And children younger than 10 are maybe half as likely to get it, and something like that. On the other hand, their behaviors, the fact that they're a lot more interactive, means that they could well be just as likely to spread it. So if somebody tells you that children can't spread COVID, you need to tell them to check it again. Quoting from this article, several studies from Europe and Asia have suggested that young children are less likely to get infected and to spread the virus. But most of those studies were small and flawed, said Dr. Ashish Jha, director of the Harvard Global Health Institute. The new study is very carefully done. It's systematic and it looks at a very large population. It's one of the best studies we've had to date on this issue. So yeah, children can and do spread COVID. And they're dangerous spreaders of COVID. The fact that they tend to be asymptomatic, that they don't display the disease, they don't get obviously seriously ill, makes them more dangerous. Because it means that they're sick, they're spreading the disease, but you don't know it. You can take their temperatures, you can ask them about symptoms, you can do whatever you want to do. The only way that you're going to catch the fact that little Johnny is a super spreader is if you actually do a full-up PCR test. To understand the significance of that, if you don't know the history of Typhoid Mary, go read about Typhoid Mary. Typhoid Mary, I'm sure that you've heard the name. Typhoid Mary was an asymptomatic carrier of typhoid, and her story demonstrates just exactly why it is that kids can be so dangerous as carriers of COVID. Now, there are things that we do know about COVID that have become increasingly clear. One of the things that we know is that we've got a pretty good idea of the kinds of environments where COVID most easily spreads. So, article from the Wall Street Journal, 6 months into the coronavirus crisis, there's a growing consensus about a central question. How do people become infected? The major culprit is close-up, person-to-person interactions for extended periods. Crowded events, poorly ventilated areas, and places where people are talking loudly or singing in one famous case maximize the risk. Now, read that description, the description of the ideal place for COVID to spread. Close up, person-to-person interactions. over extended periods of time, poorly ventilated areas, places where people are talking, singing. If that is not a description of an active, engaged classroom, I don't know what would be. You look at what goes on in a class, and on the face of it, it's the ideal place for COVID to spread. And in fact, there's plenty of evidence that it does just that. I won't go through all of these. We know that kids carry as heavy a viral load as adults. We know that there are numerous studies that show that they could spread it. We know in classroom type settings, even though schools haven't been open, that here in Oregon Child Care Center had at least 20 COVID cases, 8 of them kids, coming from a kid who was an asymptomatic carrier. Upstate New York, DeWitt, a case where a kid who was an asymptomatic carrier comes in, and you wind up with 16 people with COVID spread across 4 families. Live-in school in Queen Creek that was supposedly doing everything right, and you wind up with 23 students and 8 staff members. A school in Toronto where, again, they were doing everything right. There were only 11 kids in the class. They were distancing, they were masking, all of that kind of stuff. 1 kid came in infected and was a super spreader. 9 of the 11 kids in the class got it. Another adult in the school got it. A kid in another class got it, tracing back to that 1 case. Anyway, the long and the short of it is that if people tell you kids can't transmit this and, classrooms are safe, that's not where COVID gets passed around, we know better. There's a really good example of that too. Here, I showed you curves before. Here's the United States. Here we go. Country I want to look at now is Israel. Israel kind of did it right at first. They clamped down tight. They got their numbers down. A country of about 9 million people, they got it down to something like 50 cases a day. They thought that they had this nailed. And so in mid-May, they removed a bunch of restrictions, including opening up schools. What do you suppose happened? Well, it takes about 2 weeks from when you are infected with COVID before you get to the point that you were symptomatic enough, sick enough, that you get tested and the test starts showing up in data. And so sure enough, 2 weeks after the reopening in Israel, cases started to climb, and they started to climb rapidly. Israel is just on a rocket ship trajectory with COVID right now. And if you look at what happened, 2 weeks after reopening, there were 130 cases at a single school. 42 schools were closed indefinitely. 6,800 students and teachers quarantined. By July 15th, it was up to over 2,000 students, teachers, and staff with COVID. 28,000 in quarantine. Almost 400 schools closed. And if you look at the numbers in June, it is really telling. They were doing contact tracing. They were figuring out where this disease came from. 47% of all infections, basically half of all infections, traced directly back to schools. Wall Street Journal, July 14th article, looking at this in retrospect. Epidemiological surveys by Israel's health ministry showed that after Israel opened its entire school system without restrictions on May 17th, a spike in infections occurred among the country's youth that later spread to the general population. And so there's a place where we know what happened. What happened in Israel was they opened up classrooms and the infection started to spread. And it spread from kids to teachers to families to out into the community to workplaces. And that was the driver for their current crisis. So it's important to remember. You will hear people talk a lot about, well, maybe kids aren't affected that much, and so maybe it's not that big a deal. Maybe we can open schools, and maybe kids aren't affected that much. The reality, though, is that we know that schools can be the epicenter for outbreaks that spread throughout the community. So the decisions that you make about what to do with schools, you are not just making for school children. You're not just giving families the choice of, well, shall we put our kids in school or keep them home? You are making decisions for the community as a whole. That if you open schools and COVID spreads, there will be people who become ill. There will be people who die, never knowing that the chain of infection that got them ran through a campus. So when you think about this, you have to think about it in that larger context, because you have a responsibility to the community every bit as much as you have a responsibility to the kids. I should say a few words about teachers as well. Something like 1 in 4 teachers in the United States are at risk of severe illness from COVID. Some of that is just age. Some of it includes those who have other kinds of vulnerabilities. 1 in 4 teachers are in categories that if they get COVID, then there is a high likelihood that it could be devastating for them. You know, it makes for nice cartoons. There we have a teacher completely terrified there in her Petri dish. And I'll point out too, Teacher of the Year banquet. Teacher of the Year, Miss Smith, can't be here tonight. She's busy waiting tables. Were I a teacher, I'll be honest, I'd stand up in front of you and I'd say, you are not paying me nearly enough to walk into a classroom full of kids, given what we now understand about the way that this thing behaves, the way that this thing spreads. But you say, okay, so we can't just open them up willy-nilly. We're going to be really, really careful about it, and we're going to do that by following things like the CDC guidelines. So, okay, let's look at that. Let's look at the CDC guidelines here for a second. If you haven't actually sat down and read them, they are a rather interesting read. I'm not going to go through a lot of it here. Staying home when appropriate. This is kind of a funny one. Yeah, we're all supposed to stay home if we have any question, except if we're asymptomatic, then how are we supposed to have that question? How are we supposed to know that about our kids? Also, people are saying send your kids back to school so you can go to work. People, for as long as there have been people who sent their kids to school so they could work, have been sending their kids to school sick. That's not going to change now. You're in fact incentivizing that kind of cheating. Oh, what else to talk about here? I mean, again, respiratory etiquette. This is a fun one. Okay, if you sneeze, then you're supposed to be sure you catch your sneeze in a tissue, and then you throw the tissue away, and then you wash your hands for at least 20 seconds and do all of that. And then there's also the 60% alcohol, and you can do all of that if you've got that. And then you have to dispose that. But wait a minute, to do that, I had to take off my mask, and now I blew my nose. And so now what do I do with my mask? But you know, usually if I sneeze, it happens like that. And so if I sneeze and I'm a kid, I just sneezed in my mask, what do I do? Do I try to wipe my mask? I don't know what I do with my mask. Anyway, it's kind of silly stuff to imagine that kids are going to do that. There are other fun ones in here. Cleaning, disinfecting, sharing objects. Avoid sharing electronic devices, toys, books, and other games or learning aids. Isn't the whole purpose of getting kids in school so they can share their toys and books and games and learning aids? I mean, if you're not doing those things, then what is it that you're supposed to be getting out of school in the first place? Um, yeah. Anyway, and then if you do, well, after you use them, you then have to disinfect them or have them disinfected. But the kids can't disinfect them, and you can't disinfect them when the kids are nearby because you're using dangerous chemicals, and yada, and yada, and yada. And everybody has to face front, and everybody has to stay 6 feet away from everybody else. And of course, everybody's masked, and there are partitions any place you can put them, and there's tape on the floors to tell kids where they're supposed to stand, and they're not supposed to have any direct face-to-face interactions, and no sharing items, and no touching, and no moving around, and no, and no, and no. And all of a sudden, you found yourself in a situation that looks like a horror movie describing a really, really bad turn of the 19th century English grammar school or something like that, being run according to the kinds of rules that you use to run a COVID ward at a hospital. I mean, at this point, if you look at those restrictions, I think the kids would probably be interacting a lot more if they were back at home, talking to all their friends on Zoom and sharing stuff and so on and so forth. And so when you look at what it is that kids are supposed to be going back into the classroom for, and then you impose the necessary restrictions associated with COVID, it's not clear that you have accomplished very much by trying to open up face to face. I mean, let's face it, there are two possibilities. One, unlikely, is that kids will be badgered into following all of these rules, in which case, okay, what are they getting out of it? Or two, more likely, is that kids won't follow all of these rules. They'll do what kids do, and COVID will spread. So, we'll be really careful to follow the guidelines. Most of the time, the CDC guidelines are going to be impossible to meet for districts. They're going to be impossible to meet in classrooms. Here's the biohazard disposal is the new school toy box this fall, I guess. And the thing is, that's the CDC. If you ask the panel that got together for the National Academy of Science, Medicine, and Engineering, they say those guidelines aren't enough. And the reason they say those guidelines aren't enough is because those guidelines aren't enough. Because we've learned, for example, that COVID is much more airborne than we thought that it was. And so if you talk to these people, they start talking about all manner of things. Here's a New York Times article that reported on the National Academy panel. The National Academy panel said, we urge that schools reopen, and that was entirely because we want schools to reopen because we understand how important schools are, and sitting there in front of a computer is not a substitute for that. I agree. We all know that. But the ivory tower set are interesting, and they're also naive. Start with the interesting. They looked at it and said this airborne thing really matters, and so you're going to have to spend a lot of money upgrading your physical plant. And then they showed that they were really naive about what goes on in honest to goodness classrooms. Let me just read a little bit from this. Dr. Ashisha Jha, the director of the Harvard Global Health Institute, and other experts noted that the committee did not address the level of community transmission at which opening schools might become unsafe. They punted the most critical question. And that's the most critical question for you guys. You would probably like to say, okay, we're watching the numbers in our community. When is it time for us to say our schools just got unsafe and shut them down? They basically said, we are not competent to answer that question. That's up to you guys. Now, If a panel formed by the National Academies of Science, Engineering, and Medicine can't figure out how to put together good guidelines for when it's time to close schools, no, that's for you guys to figure out. Some 54% of public school districts need to update or replace facilities in their school buildings, and 41% should replace heating, ventilation, and air conditioning in at least half of their schools. One of the shocks to me is that over 50% of the school buildings are awful, says the committee chair, Dr. Bond. All I can say is that Dr. Bond needs to get out more often. She clearly doesn't have any insight whatsoever into the realities of what public schools are like. New evidence suggests that the coronavirus may be airborne. That's beyond suggest. That is accepted at this point. And that many indoor spaces may need better filtration to prevent infections. Between now and September, you're not going to be able to put in a new ventilation system, she added. Yeah, that's true. Although they say before you get back into the classroom, you have to have that ventilation system, because without that ventilation system, then a classroom is the kind of place that COVID spreads in easily. And so, in the meantime, schools may be able to opt for simpler solutions. Before the weather cools, they might emulate their counterparts in Europe and move classes outdoors, set up tents, or build outdoor classrooms, said Jennifer Nuzzo, an epidemiologist at the Johns Hopkins Center for Health Security. That's going to be, in Phoenix, I know that's going to be interesting. See them try to put up a bunch of outdoor classrooms so that kids can go out and try to do something meaningful in 120-degree heat, which isn't going to make any difference because there's no way that they're going to come up with the millions and millions of dollars that will be required to do the sorts of upgrades that the National Academies panel was saying needed to be done. And again, back to teachers, some 28% of the more than 3.8 million full-time teachers in the country are older than 50, and about a third of school principals are over 55, age groups at high risk of severe illness from coronavirus. Okay, the committee chairperson's response to that, well, the school workforce issue is really not discussed that much. Yeah, that's big of them. Anyway, I get to laugh at these folk a little bit because I spent my life in those circles. I'll just leave it at that. I spent my life in those circles. Here's my take on it. There we've got the National Academy in its ivory tower saying, you know, if it weren't for the pesky students, teachers, parents, old buildings, limited budgets, lack of time, and the weather, our plan to reopen schools would work great. And that's pretty much where they are on that. But then it gets worse, almost comical. Here's one of their recommendations: urgent research. The research community should immediately conduct research that will provide the evidence needed to make informed decisions about school reopening and safe operations. The most urgent areas for inquiry are children and transmission of COVID-19, the role of reopening schools and contributing to the spread of COVID in communities, the role of airborne transmission, the effectiveness of different mitigation strategies. And I looked at this for a minute and said, oh, wait a minute. And then I realized what this reminded me of. If you've not read Catch-22, I haven't read it in a long time, but a great book. Catch-22. Okay. Air Force in World War II and its craziness. The only way to actually get out and go home is to have someone declare you to be insane. Okay. The only way to be declared to be insane is to actually go and see the shrinks and say that you want them to declare you insane. But the very fact that you are sane enough to ask them to declare you that insane means that you're sane enough to stay. So that's catch-22 in a nutshell. The National Academy recommendation about research is a catch-22. We must make informed decisions about how to open and operate schools this fall, but it will be impossible to make informed decisions until long after we have already opened the schools, because the research that you're talking about there isn't research that gets done overnight. Although, again, things are moving. And frankly, you look at this children and transmission of COVID-19, there actually is a big study that just came in that I talked about that says that, yeah, they definitely transmit it. Role of reopening schools, the data out of Israel says, yeah, there's a country where it was schools that pretty well blew the place up. Role of airborne transmission of COVID-19, that one we pretty well got nailed. It does. The effectiveness of different mitigation strategies. If you don't understand the effectiveness of different mitigation strategies, how in the world can you pretend that you know how to open schools and mitigate? Anyway, so that's the reality. I want to stay away from politics, but I can't stay away from politics completely. No one has ever said that safety guidelines for aircraft are meant to be flexible. The Boeing 737, for example, there were 2 crashes that killed 346 people that have turned the aviation world on its head, trying to figure out the safety of the Boeing 737. And then along comes COVID. We've got 3.8 million cases and 141,000 dead in the United States alone. And Betsy DeVos says that CDC school guidelines for coronavirus are meant to be flexible. Meant to be flexible. I don't think so. There is absolutely nothing flexible about those guidelines, about those rules. Those are all based in, look, we know how COVID spreads. These are the things that you have to do to keep it from spreading. We know a lot of these things because they're the sorts of things that we have to do in hospitals to keep it from spreading. And even there we have trouble with it. Again, rule 1 is that COVID-19 is making the rules, and COVID-19 doesn't care. Rule number 2 is see rule number 1. The only way that you can stand by a statement like the CDC guidelines are really just kind of vague suggestions that they're meant to be flexible. The only way that you can actually stand by a statement like that is if ultimately you don't care if there are outbreaks, and you don't care about the lives of teachers, and you don't care about kids, and you don't care about the schools. Because under those kinds of circumstances, the schools aren't going to be functioning anyway. One of the hard lessons that we have to learn at around age 3 or thereabouts is that just because you want something doesn't mean that you get to have it. Say that again. Just because you want to be able to reopen this fall doesn't mean that you get to. COVID's making the rules, not you. So, what's the likely outcome for most districts that try to open up face-to-face this fall? And there will doubtless be some. If you're someone that's part of one of those decisions, you don't want to be the first out of the gate. Because what's going to happen? First of all, in most districts on day 1, there will be numerous carriers of COVID on most campuses. You know, right now, for example, in Arizona, we're somewhere certainly on the high side of 2% of the population is currently infectious. You open schools today, that means that on a campus of 1,000 people, you have more than 20 people who were COVID positive on that campus. Most of them are asymptomatic because the asymptomatic carriers are the ones who spread it. On day one, you open up, there are going to be carriers on campuses. Within a couple of weeks, that means there are going to be outbreaks on many campuses. Now you've got a situation where you've got this campus, what's going on here? What's going on here? Pretty soon, instead of running a district, you've got in different schools that are all trying to do different things. Coping with that is chaos. It will be a logistical nightmare for the district, while at the same time, there goes the accelerating community spread, like was seen in Israel. Illness, death. That's going to annoy people. Teachers are going to revolt. Parents are going to revolt. There are going to be all sorts of political actions taken. Governors are going to come in and say, we'd better shut things down again, and so on and so forth. And you are going to be right back to square one in crisis mode. So, there's the analysis. Let's just do it the easy way here. Here's what it looks like probably if you try to open schools face to face this fall. Yeah, there you go. It's going to blow up in your face. And I wish that weren't reality, but I am pretty sure that's reality, and that's what all the data says reality is. And, what can I say? I'm an astrophysicist. I care about data. I care about what's real. But that doesn't change the fact that kids need what schools provide. Those social emotional issues are there. The kids that are most at risk are the ones who are hardest to reach if you're not face to face. All of those statements are true. All of those statements matter. And COVID doesn't care about any of them. COVID makes the rules. Which means that we're having the wrong discussion. The right discussion is, okay, until the pandemic is under far better control, what can we do to better meet the educational and social emotional needs of children who are not on campus? I think that maybe if the very intelligent, dedicated people who were trying to come up with ways to do some fancy A-B schedule, this, that, and the other thing way of trying to turn classrooms into little hospital wards that can keep COVID at bay, if instead of doing that, they were putting their effort into how can we actually make remote learning work? How can we reach these kids? What are the social emotional needs? How can we support parents? How can we set up cohorts? What kinds of community resources can we bring to bear? Those are the questions we should be talking about, and not the notion that maybe somehow we're going to figure out a way to not have this thing blow up in our faces if we try to open in person. Thank you very much. And again, thank you for all that you do. Your students, your teachers, your communities look to you to do the right thing. Thank you.